Okay, good afternoon, everyone.
Good afternoon.
Thank you. We're going to get started. If I can have somebody close the door in the back, just in case. Okay, welcome. My name is Yvonne Gonzalez. I'm the CDC Plus trainer and statewide coordinator. I'm here to assist you today with the presentation. This presentation is geared for new representatives or consumers. Okay, those of you that are already on the CDC Plus program, this will be like a refresher to you. And what I would like is that if you have any questions that come up throughout the presentation, that if you filled out this pink form, if you don't have the pink form, we have some white pages in the back there. So if you can put your questions on here, okay? Because hopefully I'll answer them throughout the presentation and you'll get an idea of what the program is about. So today's presentation will be what is the CDC Plus program. I'm going to describe it, state all the different responsibilities of the different persons involved, and give you some small updates of what's happening new. The Consumer-Directed Care program began in the year 2000 as an 8-year research and demonstration project, as a pilot program. Some of you have been on since the beginning. And then after 3 successful years in January of 2004, it entered the demonstration phase. In March of 2008, it became a Medicaid state plan, a permanent Medicaid state plan option under the 1915J. That is what allows family members to be providers for their own consumers or individuals. As of today, as of June 1st, we now have 2,032 consumers self-directing their care. And we are very pleased with that.
Yes, we are.
Forgot to point out that I am also a representative for my 2 children who are on the program. I have a daughter who's 13 and a son who's 23. And I was telling someone, I remember when I first started the program, I said, what do I have to do? I have to do all these documents and all these things? Can somebody help me? So I'm here to help. I'm here to give you technical assistance. I remember that when we started in 2009, and basically I want to walk you through it. So, what is it all about? It's a long-term care program. It's based on the principles of self-determination and person-centered planning. It's based on the individual, what her needs are, what her goals are. And you will be able to direct that by listing. You have the freedom to decide where and with whom you will live, authority to decide how you will live, support the individual will need to make his decisions, control over the resources needed for the individual's support, and most importantly, you will have responsibility for all the decisions and actions. We have a lot of flexibility with the program, but we have a lot of responsibility as well. So you will control what services and supports are needed, who your providers will be, whether it's an employee or an agency, when they will be given, during the day or in the weekends, where, out in the community or in your own home, and how the supports and services are given. You will be, the representative will be the person training that employee on how the supports will be given. So let's say you're interested in being in our program, which you are today. You need to first be enrolled in the Developmental Disabilities Medicaid Waiver, now known as the iBudget Waiver program. If you're on the waiting list, you need to be enrolled in the program first, in the Medicaid waiver. And live in your own home, or family home. You can't be in a group home. You will need to take a training, CDC Plus training, which consists of similar to what I'm going to today, but it'll be about a 6-hour training, 9 to 2. The next training I will be having is on July 30th. I had mentioned to a few persons in the, if you, next to your signature, if you can tell me that you're interested in the training. It's going to be a webinar. I do that so that we can assist as many people throughout the whole state. You can do it from your own home. You don't need to go anywhere. And after you take that training, you need to pass an open book readiness review with a score of 85% or better. And then you will need to select your consultant. She is your waiver support coordinator who's been trained in CDC. You will next need to fill out the application. It's a 2-page application with the IRS forms. Because remember, now your son is the household employer and he is opening up a small household business. This next step, or the first step, would take about 45 days. Once you're enrolled in the program, you will be asked to write a purchasing plan. So you would start thinking about the employees you want to hire, and you would have them interviewed and then background screened. And then each of those employees will fill out what's called an employee form, an employee packet. It consists of all these other forms, W-4, I-9, the affidavit with moral character, and direct deposit forms. If you hire an agency, you would do a vendor form. So some of the building blocks into getting the purchasing plan. You would have your support plan just like you do now on the waiver. And then you would have your cost plan. With those 2 pieces of information, you will be able to create what's called your purchasing plan. How am I going to purchase those supports and services? There you will list all your employees, what the rates of pay are, and what services you'll be using. You're going to have your monthly budget. How does that get calculated? Well, you're going to take your cost plan, have all the services that are listed there. You're going to divide them by the number of months, probably 12 months now, because we have the new fiscal year. Cost plan was coming up now on July 1st. And you're going to have a discount rate of 8% and a 4% administrative fee. Okay? And that will become your flexible monthly budget or monthly amount. We're going to give you guidelines of what's allowed on the program and what's not allowed. So you're going to have some services that you know you would be purchasing, but you're going to have some other services additionally that you will be able to save for. This is what the purchasing plan looks like. This is just the first page, just basic information. It's in Excel. It's only 6 pieces of paper. We'll walk you through it when I do the training, and you'll be able to develop. So I like to compare what is the difference by staying on the med waiver, the iBudget waiver, or moving on to the optional program of CDC Plus. Well, with the iBudget cost plan, we have service families called life skills, supplies and equipment, personal supports, therapeutic supports, transportation, and dental. And you must use the same Medicaid waiver providers with their established rates. Okay? You don't have any choice with getting other providers. When you move on to CDC Plus, you have your cost plan minus your 8% and the 4% administrative fee, which will give up your reduced budget. And you have additional services that are not on the waiver. One of them is advertising. You need to hire someone. You need to put an ad in the paper. You can save up for that funding to be reimbursed for the advertising. Seasonal camp. A lot of the kids on the program are minors. You know that it's really important for them to go to summer camp. We get justification, put it on your support plan, and then you would transfer that information into your purchasing plan. Personal response system, therapeutic equipment. I had someone ask, well, what happens when I need my wheelchair fixed? You need to go first through Medicaid or Medicare. If they don't reimburse you for that or they don't pay for that, you get a denial letter, and you can request the other adaptations that you need for the wheelchair through your savings. Okay? We have specialized training and other therapies. someone needs massage therapy. I can save up because I'm hiring my employee at a lesser rate than the provider will be if I had to hire them as an agency. The example I always like to use is the PCA comes in at $15 an hour for a minor, $15 an hour. I take my 8% and my 4%. That will be $13.20 an hour. I pay my employee $10 an hour. I have $3.20 an hour that I'm saving up for. That $3.20 an hour keeps adding up for 40 hours a week times how many months? 12 months. That becomes a big amount. My employee's happy. She's getting paid at a higher rate than the agency would have paid her. My children are happy, and now I have extra funding that I can purchase either additional hours for personal care assistant. I can get respite. I can send my son to the summer camp. I can have him have massage therapy. Whatever is important for that consumer, that individual, that meets his needs and goals to make him more independent and have a better quality of life. That's what we want for all our children. Okay? So you're going to be able to negotiate the rates, hire your employees, train them, and submit the timesheets and invoices for these employees or these agency vendors. What we have is called restricted services. These are services that are restricted. You need to purchase at least 92% of the units of measures for them. So let's say I ask for occupational therapy. I need to use that same occupational therapy. I ask for 12 hours, 92% of that is about 11 hours. I need to have that 11 hours in my purchasing plan and use it up for that. I have that 1 hour left that I can convert into an unrestricted service. So all these services need to be used identically. They can't be interchanged. Respiratory, speech therapy, these are services that meet medical necessity. You need to get a prescription for, so you cannot interchange them. Then we have what's called unrestricted services. These can be interchanged. They are not under any medical necessity. So let's say I had adult day training 5 days a week. My son or daughter decided to go 3 days a week to the adult day training. Now he wants to have 2 days of companion. He can do that. You can do that on the waiver as well. It's a quite simple way to do that. But let's say he felt something else was more important to him. Maybe he wants to go to the gym. He wants to take part of that funding from that adult day training and add or use it up for the gym membership. Or perhaps maybe he wanted to go and go to supported employment. Probably, maybe he wants to take some of that funding to go get a job. He can use that with transportation. He can maybe go to some specialized training that he needs. Or perhaps he's an adult and needs some consumable medical supplies. It's not paid through Medicaid. You can now save for it, save for that item or that service, and get it through the CDC Plus savings. All right, so we're going to go into some of the roles. The participant is the consumer or the individual, the representative, the consultant, the area liaison, and the fiscal employer agent. So I have some of the panel here that are going to assist me with this. So the first one is the representative. My son or daughter cannot sign all the forms. He needs to get a representative. He needs to be at least 18 years of age. And it's going to be someone that does this voluntarily. He will not get paid or benefit from any other business or authorized to provide any of the service for that participant. So the first person I have is Trisha Madden. She is a representative for her son, and she'll explain to you what she does.
I think this is almost the beginning point where most people get scared about trying CDC Plus. It sounds horrendously full of details and paperwork. My son's been on the program since almost the very beginning, 2001, and I love it. When iBudget came along, you get more flexibility, a little bit more flexibility in money. You don't lose money like you used to, but you don't really control it as much as we do on CDC Plus. And what I love about the program, I want to tell you two things. I'll tell you more detail, but I love the fact that I get to choose and adapt my son's programming, because his needs change month to month sometimes. He was in the hospital in the ICU for 23-hour days. You can guess we didn't use that money for companion arrest at that time. But we did use it for PCA to come help me in the hospital. There was just so much I can do with it. We travel out of town. The other thing is, when you hear about how to do all this, it sounds downright scary. But once you're trained by Yvonne through the program, and once you've done it one or two times, you're going to realize that it's worth it, because you, again, get to decide, not based on what some generic format of what a person with disability can do. You're going to be able to base it on your family, your child, or if you're not the immediate family, the family you're helping. Now, a representative, that's the one who has to do the paperwork, and it sounds downright stopping. You should have been with us when we started the program, because they kept changing the rules in the early days when it was an experiment. It's been fantastic. I can meet Kevin's needs. If he's sick 1 month and I want to keep him out of the daycare center or ADT he goes to because I'm afraid he's going to get the flu or something, and he's been through cancer and everything else, I can save that money up, and the next month I can use it. I can either get a respite come in, or I can save it for something else where I need more PCA, and I'm trying to get over the exhaustion I got the first month when he was home, and let the PCA come in and take him to Disney World, or take him to, I'm in Orlando, you can guess. You can take him to movies. Kevin sees more movies than I see ever. He's got a much better social life than I have, and it's because with CDC Plus I can do it. Now I'll tell you quickly, the paperwork you do as a representative is your responsibility. But once again, once you're training, the first 2 or 3 times it's going to sound like a nightmare almost. But you've got people in every area. You've got an area liaison who can help you do it. You've got to ask for, first of all, somebody who's a coordinator who's trained in CDC Plus who can help you. So you really are not left out by yourself the first few times. It sounds like you are sometimes with the paperwork, but you've got help and resources you can get locally. There are support groups now in a lot of our towns. I happen to be on the Orlando support group. A lot of us can help you because we've been there, done that. It is worth the value. One of the things, like hiring employees, negotiating pay, that sounds kind of scary too. And as a representative, you're required to do that. But think about, otherwise, I get people handed to me that may turn out not to work with my kid at all. Or I'm sorry, my kid is 41 years old to me. So is my first lieutenant commander at combat pilot is a kid still too. So I'm not discriminating against him. Both of them are kids, and both of them need a lot more training. But anyway, you can get people to. I use a lot of times the people who work in his workshop because they know him so well. And the advantage to that is after hours, they need a second job. A lot of them have them. They can handle him beautifully. It also gives him a little more clout with what he gets in the day program. Hiring people is like just meeting people or looking for people. It sounds terrible, but again, you can look at the local workshops. You can advertise as it says. You can call your area offices and ask them if they have any people. They can't recommend people, but sometimes they'll have lists of services that are available in your area that you can make contacts with. Sometimes other agencies. In fact, I don't use agencies in hiring employees because, like Yvonne said, I want to pay for quality help, the quality I need, and this allows me the flexibility. If I'd rather have a higher quality PCA worker than spend it on respite or on companion, I can do that. I can switch the funds between the categories. It makes it great. When you come out to negotiating rates, it's got two importances. You can economize at times if you choose, or in my case, I choose to pay more to get better help. So, but you control this, whereas with the iBudget alone, you have some limitations in that. The other part of this is ensuring the background screening. You have to do that as a rep. It's really difficult. You call downtown and say, hey, do you have any organizations that do backgrounds? Can you tell me the names of them? They won't tell you who to go to, but there are usually people in town, in your area, that's the company's used to coordinating with APD. You just send the person down there and they're screened. In fact, I'm getting ready to get myself screened just in case someday, as a rep, I don't have to be screened. I thought, you know, what if something changes? What if one day my husband, who works with my son, no longer can do it? What if all of a sudden I have to switch roles or something? What if I have to find a rep do my own job, and I have to start working with Kevin because, you know, our life right now is partly based on the fact that my husband gets paid to take care of Kevin. Otherwise, we'd both be working, and Kevin would have fallen into the loopholes. It's not a moneymaker for us. It's not a moneymaker, it shouldn't be, but it is a way of providing the care for Kevin that Kevin needs if he keeps picking up disabilities left and right. Signing the documents and all, Yvonne will take you through the training. That doesn't stop the first time she trains you. She's available. Other people are available in your area to help you go through the forms. It is scary the first time because it's paperwork. I'm a lawyer, or I was. I'm supposed to be retired. Paperwork is what we did. I took my life to it. I don't need more paperwork. I pay bills every month for myself, the house. Same thing with CDC Plus. You just write it out. The nice thing about CDC Plus, though, unlike when I ran my own law firm, they act as the banker, the payer for you. They do all the W-2s. You get, yeah, she looks at the forms for you that you have to fill out, but once they're filled out, the nice thing is you just ship them off to CDC, to APD, and they act as the employer. It's like having Prime or some of the other companies work for you. Only it doesn't come out, it does not now come right directly out if you're not paying it yourself. It's figured into your your budget. It sounds also like the other thing you can do is you're responsible for the Medicaid funds that is the money you get from CDC Plus. And the other thing is, there's a part of it about cooperating with quality assurance monitoring, that is what we call Bill Monitor. And that's just making sure we're all on top of it, and it's not a scary thing.
Okay, now the consultant roles. Adrian Dissy.
As you can see, the consultant's role looks very similar to that of your support coordinator. We are there to help with support plan development, address any Medicaid eligibility issues, monitor health and safety, report abuse and neglect, and do our Medicaid contacts. In the day-to-day activities of a representative, there are so very many questions that come up, whether it has to do with payroll issues or the outcomes that you want your child to be reaching through the purchases that you make out of your purchasing plan. This is where the role of the consultant becomes critical. You have to have a great rapport and know that that consultant is going to be there for you when those questions come up, and they come up frequently. So the one role that stands out for the consultant is that we are there to provide the ongoing education, the ongoing technical assistance, and the guidance that you need in order to achieve all of those roles that you just saw as a responsibility of being a representative.
Okay, thank you. And the regional liaison, she is the person in each area, or each region now, that has communication with the rep, the consultant, and before all the forms are sent to the state office, she's the person that reviews everything and makes sure all the background screening results are available to be given to you. And she oversees the corrective action plans and background screening. Okay, the state office in Tallahassee. I'm going to let Ms. Susan Nipper, our CDC Plus administrator, go on and tell us what you do.
Hi everyone. So in the state office, we oversee the CDC Plus program at a state level. We assist by helping to develop the policy and interpret that for you guys. We help to make sure that quality assurance monitoring process works smoothly for you and that everyone is complying with those requirements. We perform the fiscal employer agent duties, so we're running the payroll for you. We're ensuring that the paperwork that you complete for your employees is filled out properly, that those tax forms are handled for you. We process the payroll to ensure that your employees are getting paid timely. We are there for technical assistance, for guidance, for whatever it is that you need to make this a successful program for you. Okay? We assign provider ID numbers so that you know when you go to submit those payroll claims for your employees. We have 3 different ways that you can do that. You can do it online, you can do it over the phone, with a touch-tone phone system, or you can call and speak with our customer service agents who are available from 8 to 5 Monday through Friday. You'll be able to do those things. We act as your banker, we act as your bill payer. We send out statements showing the account activity on a monthly basis. So you'll be able to have that information as well.
Good, thank you. Okay, just some reminders. every employee needs to have a level 2 background screen done. They need to send in a clearance letter before they start working. And it's valid for 5 years. If they have a break-in service, they need to have the background screening redone again if they have a break-in service for 90 days or more. So they need to go back and have it screened again. If you want to know more information, we have a website, apdcares.org/CDC+. And you as a participant, we have our webpage where you're going to have the information of the rule handbook. There it will list all the services in each detail. It will describe the service and what the qualifications are and whether it's a restricted or unrestricted service. We have a participant notebook that is being revised. It's in English and Spanish. It'll give you more tips on how to hire employees, etc. We also have the appendix. That is where all the forms are. Look on the website for more updated forms whenever you need to do an employee packet or a vendor packet. So I'm pleased to announce that now we have 11 support groups throughout the whole state. I'm really glad that we were able to extend that because when my children first started the program, we only had one in Miami and in Tampa. So we want to call out the names of the persons that are the chairpersons for each of the areas. We have in Miami, we have Yolanda Herrera. No, I'm sure she's here, right? Okay. In Key West and Key Largo, now we have Dorothy Cleaver. In Broward, we have Gilda Pacheco. She's in the back. Thank you. In Fort Pierce, we have Stephanie Presson Brown. She couldn't make it either. Teresa Brown in Melbourne. Trisha Madden from Orlando. Derek Tainer, he was here earlier, he had to leave. He's the one from Daytona Beach. In Gainesville, we have Kalisha Eagle. In Jacksonville, we have Melinda Morrison. In Largo, we have Judy Cole. And in Tampa, we have Joanne Dusk. Did I say that right? Thank you. Anyhow, that support group is not just for going there to talk about the problems. It's there for solutions. We have about half an hour of technical assistance. I usually do it via the phone, wherever the support group meetings are. They're done about every 2 months. And I'll be on the call and I'll assist you as well for technical assistance. And it's a good way to find out what the other parents are doing with their supports and services. What's working for them? What are good programs can we go to? So once you take my training, the next one will be on July 30th. I send you a certificate that you passed. If you didn't pass, we'll let you do it again, okay? And then I'll get your email, send you the link of when the next support group meeting is, and you'll know if you can attend or not. And we also do it via phone. If you can't go to the meeting, maybe you have something else to do, you can be in your own home and connect that way.
Do you have one in Tallahassee?
We have one in Tallahassee when I go. I tried to get a chairperson there, but she decided not to do that. But if you live in Tallahassee and you want to be the chairperson, yes, give me your number on the sign-in sheet. Tell me that you want to be the chairperson and we'll set it up. I usually go to Tallahassee about every 3 months. I live in Miami, so definitely we need that there, okay? Sometimes, some of the meetings are done at night, some are done in the morning. So it depends on which area it is.
And further west in the Panhandle as well. So there's a need.
Right.
When is the training?
The training will be July 30th, 9 to 2.
Where?
It's from your own home. From your computer. Webinar, yes. If you like, right next to your signature, let me know when that you want to attend the training so I can send you an email with the link. And before we get to the questions, do you want to talk about what we want to enhance the program with? Some of the new things that we want to make it?
Sure. So one of the things that we are working on currently is making the program a little bit more streamlined, hopefully a lot easier for folks. We're looking at having the purchasing plan system become an electronic format. Okay, yay, see, yay. Doing away with the paper. Right now, CDC Plus, we don't require consumers or their representatives to have a computer, so you may not say yay. But where support coordinators and consultants are required to. So you would still, perhaps if you don't have a computer or have that access, submit that document in paper to your consultant, who then would put it into the system electronically. Having an electronic approval flow so that it can make it a lot faster for you in getting things up through to state office.
Do you still need to have the paper copy for Delmarva? You know, if it gets into this electronic, you still have to have a paper one in your file for when you have Delmarva review.
Right, and doing it electronically, there would be that approval, so you would have the electronic approval. You could go in there, print that out, and keep it in your paper files.
Thank you.
And yes, it would be through an encrypted site, so it would be absolutely secure.
What would you be doing to keep new fraud from happening? Because any coordinator, anybody can fill out an electronic and get.
You would be able to see everything that's going on with the actions that occur.
Okay, because you would have to have some kind of signature as well, correct?
Right, we would have to work on an electronic signature process.
We also
so
have
these are still in the planning stages. I'm working with my team and with IT to see and build the requirements so that we can have something, hopefully, within the next year or so.
Right, you would also have a username and password as a representative, so you are the only one that has that information. You can't give out that information to anybody else. So you would be able to log in with your username and password. So, we have some questions. Please, we need you to write them down so we can have history of what the questions were today. And if it's something that we can't answer, if you would give us your telephone and your email address so that we can get back with you. Okay? Does anybody have anything?
First, I have a comment. In the presentation, it wasn't clear to me for people who are new that you can hire non-Medicaid providers, both from an agency and from, direct hire, and I found that most helpful. But my question is, when the representative was talking and she said that her son was in the hospital and she took some of those funds to have PCA come into the hospital, that's what she said.
Not to the hospital.
And so that's why I'm asking, because it's my understanding, I did that one time, I got in big trouble.
No hospital. You're not in the hospital? Okay.
Right, no, that would be considered a duplication of service when the consumer's in the hospital, and if that bill is being paid through that venue, then the hospital should be providing
Let me just
services.
explain that. Maybe I misspoke it the way I said. When Kevin was in the hospital, we had points of time when he was out of the hospital. And so where normally he would have gone back to ADT, they helped coordinate us by working with us by taking him back home and doing PCA work with him at home before he ended up back in the hospital. The fact that he was in the hospital was not the lack of good care from his PCA. It had more to do with the hospital. And so we were able to balance the fact that I had already been on 24/7 with him in the hospital. So for those gaps when he got back home, I could use PCA. And I could do it in the fact that I had the PCA worker, she was already qualified, she was already trained with Kevin, as opposed to having to bring in, visiting nursing actually could not serve him the purposes because we wanted her to do things like hand therapy, but things that she'd been doing with him before she was in the hospital, she could continue to do. And there are limitations on what you can get from any other source. There's nothing she did for him that you could get from any other source.
I wanted to inform that we had to do that as well. And had it not been for the PCA that was there with her, my son would have probably died. Because the PCA there was not paying attention, and the PCA that I had was watching his blood drop to the point where they almost needed to, actually they had to give him more blood to get him back to where he needed to be. He almost died in the hospital without the PCA that I had bought. So that's got to be somehow placed in there because they didn't, whether they're not paying attention or what have you, had I not had my PCA there, we would have been in big trouble.
It is not. It is a duplication of services, so that is not something that can be paid through CDC Plus. If you want to pay privately, that is certainly your choice and your option.
Thank you.
Certainly.
But that's got to also be brought up.
I'm new to the waiver program. Thankfully, my daughter just received the waiver last week, and yesterday was our first day of having respite. We live in Usima Beach, Florida, so it was godsend as there's no respite available otherwise. So I was dealing with home health agencies telling me that seizure monitoring is babysitting and they wouldn't cover anything, just kept reducing my hours. So this is really helpful to have the waiver in the first place. I was interested in CDC Plus because my experience of having home health aides that were less than satisfactory. I knew that there was a way that I could hire my own person, and that was something I was turned on to, so that's why I'm in this class. However, I'm a little confused on, we get a budget set for her each fiscal year, and through your program it seems that there's, I saw 8% and 4%, and I'm really not familiar with that. Could you kind of go over that and explain quickly, like what, you take money out, or why is that?
Sure. So the way that works is you receive your iBudget allocation. In order to calculate the consumer's monthly budget, there is an 8% fee taken out. That's the discount rate. So that's to help maintain cost neutrality between people who are receiving services through waiver providers versus you being a household business. It sets the playing field level. Okay? And then there's a 4% administrative fee, which helps take care of the fiscal employer agent responsibilities. So for us, handling all of that paperwork for the taxes, et cetera, and paying bills on your behalf once you submit those. Waiver support coordinator does not come out and become part of that monthly budget. That comes directly from iBudget waiver. Okay? So all services except the waiver support coordinator are used to calculate the monthly budget. And then that budget, if it's for a 12-month period, you take that dollar amount, divide by 12, that becomes what your CDC monthly budget is. Does that answer your question?
The coordinator I picked, I made sure that she was both waiver and CDC Plus provider.
So that means that she can continue to be my provider, and that has nothing to do with the budget?
Right.
Oh, wonderful.
My question is from a provider standpoint. I do have some CDC clients, and one of the things that they asked me, those that want to move to the CDC, was about your 8%. So should I tell them, no, it's actually 12%, because their actual budget will come down? I don't want to give them the wrong info.
Correct.
And then she said they now have, how do I help them when they complain or they make a statement as she did? A lot of these support coordinators are not well educated with CDC. They act like once you're on CDC, they just write my client off. And I feel like I'm trying to harass the poor support coordinator. Can you call my client? Oh, I don't do that at CDC, I don't handle that. So where would I go to find out her responsibility to that client so that she didn't drop the ball? I think you got my answer.
No, I just have an opinion to your question, and that is, if you have your business, you're also responsible for the accountability or the accounting for your business. Imagine that every one of us has a business within our own house. Okay. If the state is taking care of the accounting, you have no problem. They're responsible for accounting. Well, yes, the 12%, would you have to pay? Would you have to pay an accountant? Okay, this is less expensive than paying an accountant and then having the IRS coming to ask you, what is happening?
Oh, right, I will explain that.
We have the consultant rules on the rule handbook as well.
Yeah, and so to the question about the consultant, if the consultant isn't being helpful. Okay, so a consultant not being helpful, then perhaps the consultant needs a little bit of re-education. Perhaps, I'm sorry? That is certainly your choice and option. You can always do that if that's what you want to do.
There is so few.
What county are you in?
Lake City, there's like
Suncoast.
or CDC.
Right. I also train the consultants.
Okay.
So I really get into detail with them because I live the program each day and I tell them what they need to look for. Remember, a lot of the consultants don't have children. We are happy that Adrian does have a son also on the program, and she's a consultant as well. That's why I asked her to speak to us today, so she can tell you more.
I hear that issue frequently. I think it's imperative that everyone understand that the role of your consultant, you really have to have a very trusting relationship with that person, because it's not less as a consultant, it's more. If you did not have a lot of contact with your support coordinator as a support coordinator, that may not change when that person changes the role into a consultant. If that's the case, then that person's probably not going to work for you. I find with my families on CDC, I spend much more time providing that constant re-education. I can't expect a family who had a great purchasing plan for the entire year, now it's time to rewrite another purchasing plan, but they haven't written it in a year. I cannot expect my family to remember each and every rule that is in our handbook in order to sit down and write that purchasing plan. So I don't expect my families to remember each and every rule that I live through on a daily basis. So you have to have that rapport with your consultants so that you can make sure you're getting the training and education that you need on a daily basis. For me, yes, it is different. I wear a parent hat, so it makes everything easier.
And where do you serve?
So I'm very 15.
Very 15.
Indian River Martin.
I'm a little confused between the difference between support coordinator and support consultant. You're using them interchangeably and I'm getting confused. They are the same. So we've already selected a support coordinator, but I just have to verify she
Then she
is.
becomes trained in CDC, then she
Or
becomes
she
a consultant.
Right.
It's just a name change.
It's two hats.
It is the same.
You have to have a waiver support coordinator and a waiver support coordinator in CDC who has been specifically trained as a consultant. So it can be one and the same person.
And they get a provider number as well under Medicaid.
When they end up billing, do they end up billing in different names, or what name are they required to bill? Because I've had, and are the consumers supposed to know what name they're supposed to be billed on? Because I've had one coordinator that has billed in management as a case manager, as a consultant, and as a waiver consumer consultant. So I honestly have a hard time trusting them. So that's what we need to have.
One fee. Same rate.
They're not the same rates. They're different rates. I've got bills with different names, different rates.
They're billing for something else.
Same person, different names.
Call Medicaid. You have that Medicaid monthly statement every month? Ask for.
Okay. But we just got qualified off of the crisis list, so we're waiting to do the Medicaid application. So is there a waiting list between once you get approved for the Medicaid to jump on the CDC Plus?
No, in order to be eligible for CDC Plus, you must be already in iBudget. So that would be the only waiting period that you would have. As long as the individual lives in their own or in their family home and they're already in the iBudget waiver, then this is a possibility for them.
Those are waiting period.
So I already have a coordinator or a consultant, but how do you find a list of other consultants that at the APD office?
Yeah, the regional area office.
You would get with them?
Yeah, ask them who's available.
Okay, so there's no like...
There is something on your website I saw.
But there's no like reviews of these people? I mean, there's like
Yes.
with a doctor or something?
Yes, there is.
There is a review?
What? Bart wants
Well, that's also where the peer support groups can come in and help out, is networking among yourselves and just speaking with other people who have that experience and who have positive, hopefully, experiences
with your waiver
So
support.
if you have one, and then you get on the program, you get training, you're still with your coordinator that doesn't quite, or doesn't quite do the job. So then I get with you, you send me the email or whatever of the support group, and then at that point I'll go to the support group, network, and then change it. Can you change the coordinator after you start CDC?
Sure.
During the year?
Sure,
At any point?
you can change.
Okay.
I mean, right now,
Can you repeat the question? People in the back
I'm sorry,
can't
the
hear.
question was about changing waiver support coordinator, your CDC consultant. If you're unhappy with them, the process, your local area office would be able to provide you a list of those individuals that are CDC Plus consultants that have availability in their caseload, okay? And then you would be able to select from that list. One way for you to be able to know whether or not this is someone that you are interested in having, first of all, you interview, but you can also network with the peer support groups to discuss with other parents, with other people who are using them or not using them, to find out the nuances and how this person works and see if it's a right fit for you.
Yeah, some of the consultants also attend the peer support group because they go there to learn too from other families, and so maybe you might meet someone there in the area.
Can you choose a consultant from another area?
No, they need to work in that area.
Can you repeat that just for the folks in the back?
The question was, can you choose a consultant from another area? They need to be available to you, so no, really not. If there's any kind of lag time, we can work with you on that, but you need to have a consultant who's accessible to you. Okay. Yes, ma'am.
Hi, I'm from the Gainesville area, and my son Ryan has been on CDC since the very beginning. He was part of the experimental group. He was 8 when he got it. It's the best program. I mean, it's done tremendous amount for him. I was very excited about the support groups because I also work for the Center for Autism and Related Disabilities, and I have a lot of parents who are on the waiver, and that I'm trying to get them to talk them into doing CDC. And I'm the one that they come to for all the information. I've been helping them with their support plans. I've been helping them with, changing over to CDC. So when we were starting the support groups, I attended some of the ones in Gainesville, and I was a little disappointed, to be honest with you. So what I was going to tell you is I'm offering my help with that support group. That way we can. Yes.
Write your name next to the sign-in sheet and let us know, and I'll contact you. Yes, because some groups are small. Some groups we have a chairperson and a co-chair. Like Orlando's a big area, and Trisha geared towards adults, and we have another parent who wants to do things for children. So some meetings, right? Right. The more help we get, the better. That would be good. Any other questions of you?
I'm on CDC Plus, and we received our February statement, and I usually go back and check the others because I got the paper statement from February, number one for January, and here we are already in May. So I check back, and every month it has nothing on it, 0. It just has it set up on the computer.
Well, right now the April statements are available, so I'll get with you afterwards. And are you going to be here tomorrow? If not, well, I'll take your name down and be able to get back in touch with you and find out if there's something going on. Because if there was activity during that month, if there was a deposit, if there was an expense, there should be a statement recorded, at least through April.
And the second question is, I know I had seen someplace that the Lake Sumter County was going to have a support group, but I was sick at the time and never called about it. And did anything happen with that?
What town is that? I'm sorry.
Lake Sumter.
I don't know what town was the meeting supposed to be at?
Do you know what town?
Lakeland?
Lake and Sumter counties. No, that
Okay.
would be Leesburg, Bushnell.
Lakeland?
No,
Leesburg.
Wildwood? Wildwood?
Bushnell, Wildwood.
Okay, I came in person to the Wildwood support group meeting, and there was one person that showed up. That area, They said that it's really large and that no one could come.
I was thinking at the time where I would have been there. They would have been doing it.
One person showed up. That's why we have the Orlando group is so big. If you want to be a chairperson and start the meeting there, I would love to help you with that. Put your, next to your name, tell me that you want to start a support group there, and I can help you with that.
Gentleman up here had a question. Yes.
Yeah, my son's been in CDC for about 3 years now, but this is the first I've ever heard about the support groups. Is there contact information available on the APD website for the support group?
You would need to contact me because we don't have that yet, but we will. We are working on putting that contact information for each of the support group meetings.
Right. Also,
well, we have it on the website.
Well, we have it on the website, and also the CDC Plus connection. If you're familiar with looking at that document, we've been trying diligently every single month to put a list of all of the support groups that are upcoming for the next couple of months. So you can also check that and see when the next one coming up is in your area.
They're usually about every 2 months. What area are you from? Jacksonville, yeah. You're coming up soon.
I'm basically trying to understand the CDC because I'm on the waiver and I really would like to choose who is taking care of my daughter. So my thing that I'm trying to understand is that we go to the training with you online and then we select a support coordinator.
That's all.
That's a CDC, that
right.
knows CDC. So like my coordinator is not familiar with it, so I'd have to select someone else. And my thing is that, as the earlier body saying, how do you know if that person is going to work for you? You know, from the list you said.
You can ask her, how long have you been a CDC Plus consultant? What kind of experience do you have? How many cases you have in CDC? Sometimes they maybe just have one case.
And that would
they don't have as much experience. That's how you know.
The peer support thing, I would like to know more about that and get involved. Try to
right next to your name. But, you know, want to know about peer support in what town? Okay, so I can connect you with that person.
The other thing too with the consultants and or waiver support coordinators, I don't know how well all of them play in the sandbox together, but if you have a really good rapport with your waiver support coordinator and you're looking at CDC and they don't handle CDC Plus clients, you can always ask them for a referral too and see if they know someone who is a good waiver support coordinator that is trained as a CDC consultant.
And one more thing, remember, you're independent in this program, so you need to know as much as possible because you're going to be doing all the forms. The consultants are really there for technical assistance.
I apologize if you've already touched on this. Where can we get the full outlay of the CDC program to be able to read it and dissect it?
On the website.
On our website, under the reps training. I'm sorry. Under the representative training, the whole PowerPoint is on there.
Okay.
Okay. But email me, put your name, and say I want to know more about the rep training, and I'll email you the PowerPoint.
Starting in July.
Oh, she's almost starting. July 30th, next training. Please join in.
Do we put it on the pink card?
No, on the sign-in sheet, wherever you signed in. The other thing is, I see some dads here. I'm going to try out a support group for dads in Miami. See how that works. And so if you're a dad and want to know more about CDC, or maybe you just wanted to get together with other dads around CDC, let me know if you're interested in starting one there. It's a really good way to connect. When I have an issue, I adopted one of the chairpersons from Broward and Miami too sometimes. And I call her and say, you know, what should I do about this? You know, she's 10 years older than me. I know I'm going to have to go through those stages eventually, and I contact them. So that's why this book is good.
We have time just for one last question. The next group is going to be coming in for presentation. We're running a little bit over, but we're more than happy to try and help everyone when we close this up. Yes, ma'am.
I know the next webinar is July 30th. How often is the training given?
I do every 2 months. So I do alternate, one consultant training, one rep training, like that. If you need something sooner than that, you can do that yourself. you train yourself. You look at the PowerPoint, take the test, you can do that yourself. If you have questions, then, you know, you can call. Okay? Good? All right, so this is our email, phone number, direct line for Susan and myself. Okay, but it's on the PowerPoint. We're here to help you, okay? Thank you so much for attending today.